Hello students. Today I'm going to upload a video that's in conjunction with chapter 14, which is of course medications and medication administration. Now, this is a supplemental video where we're going to talk about medications, ALS medications, and what they're usually called by medics, so you become more familiar. Although these are medications that you're probably not going to be giving to patients yourself, if you're working with an ALS provider who's a medic, you'd be expected to know what the names of these medications are and where to find them in the truck. So having a good idea that some of these medications have different names than we're used to will help you find them. Keep in mind, what we learned by going through chapter 14 is that medications have 4 names. So a medication may have a name that's a chemical name, which we usually can't even pronounce. It'll have a generic name, a trade name, and then an official name. So we'll talk about some of those differences with some of these medications. The first one that I want to start with is furosemide. Furosemide is called Lasix. This is furosemide and how it's usually packaged. Lasix is the terminology that the medic will use. They're not going to say go to the ambulance and get me furosemide. They're going to go say find some Lasix. Now keep in mind now, packaging is very specific to the manufacturer. So these 2 bottles that I have right here are both Lasix. They're both Lasix, they're both furosemide. They have different colored tops because they're made by different manufacturers. So you can't let color and bottle shape make a determination on the medication you're looking for. You got to read the labels. These both say furosemide. See if I can get that a little bit closer so you can see it. Not very well. Doesn't want to focus. Okay. Let's take a look at another one. Another one that we may run across. By the way, furosemide is used, it's called a loop diuretic. So we use that for patients who have excess fluid, and we're trying to get rid of the fluid. CHF patients, other patients that have swelling and edema, we can give them Lasix. Elderly people called it their water pill. Usually if they say, I'm taking my water pill, they're talking about some sort of Lasix. The next one we're going to look at is called amiodarone. Fortunately for you, amiodarone is going to be called exactly by that name, amiodarone. Amiodarone is a cardiac drug. It's a drug that we use to stop different arrhythmias in the heart from happening. It's very common to use, but your paramedic partner is going to call it amiodarone. Another one here, adenosine. Adenosine is also called adenosine. So there's no different name for it that you'll find. Adenosine is actually a medication that we use to chemically stop the heart. So a patient who's in supraventricular tachycardia, which is an extremely fast heart rate, that patient needs to have that slowed down. And typically it's done with that medication. After a quick administration of that particular drug, it'll cause the heart to sometimes stop for a few seconds and then usually start back up at a slower rate. We'll take a look at this one next. Ondansetron. Ondansetron is usually called Zofran. This is one of those ones that the medic's not going to tell you to go to the car and find the ondansetron. He's going to tell you go to the car and find the Zofran. This is how it's going to look. You're not going to see Zofran on there anywhere. Interestingly enough, that vial is for IV or IM administration, but it also comes in a tablet. Here's the same drug in a tablet form. You just open up blister packaging, so you just open up the back and take the tablet out. Looks a lot like a nitroglycerin tablet. These we use, it's an antiemetic. It's the drug of choice for people who are nauseated and vomiting to help stop them vomiting. And it's a pretty common prescription drug that a lot of people take. So if you're looking for it in the truck, ondansetron or ondansetron or Zofran, they're the same drug. We take a look at, here's 2 of the same drug that look a little bit different. This one is thiamine. Thiamine. Thiamine is a drug that is given usually for patients who are having alcohol poisoning. So that it's going to be called thiamine. They're not going to have any strange names for it. One that you're probably familiar with, but that you would not recognize right away, would be diphenhydramine. This is diphenhydramine. Diphenhydramine is a drug that we use for allergic reactions. You probably know it by the name Benadryl. So your medic may ask you to go to the truck and find some Benadryl. Well, you won't find Benadryl in the ambulance, but you will find diphenhydramine. It's the same drug. Some other medications. This I think you're all familiar with by right now. Nitrostat, nitroglycerin tablets. These are the ones that the medic or the ALS provider can give. These are not for you to give as a provider. Let the ALS personnel give this. They have the protocol that lets them do that. But they'll send you for nitro. This is what they want, are these small tablets here. Another medication we may have a call for is called magnesium sulfate, or mag sulfate is usually what it gets called in the field. Mag sulfate is used to relax muscles. It's a smooth muscle relaxing drug, sometimes called for in cardiac situations, sometimes called for in other situations as well. Now, we talked a little bit earlier about epinephrine, the way epinephrine comes packaged. And there are two kinds of epinephrine. What I have here are two vials of the same thing. These are both epinephrine. So they're epinephrine 1 to 1,000. 1 to 1,000 is called anaphylaxis epinephrine. This is a strong concentration, and this is going to be used if a patient's having a severe allergic reaction. They both come in vials. The vials are a little bit different shape, they're a little bit different color. They kind of work the same way though. If you're going to open up one of these vials for administration, then you probably should have some sort of cloth or something to open it. And you basically grab the top of it, knock all of the product out of there, and then you grab the top and you basically break it. And when I break it, now I have a vial that's ready to go. It's really, really, really sharp. You can see right there, there's a piece of glass that's really sharp. And you gotta cut your thumb every time if you don't use something like this to hold it. Now, the interesting thing about using vials is you don't put the needle into the vial, you actually turn the vial upside down, and surface tension keeps that medication in there, and you draw it out with a needle from underneath. So you don't put the needle actually in there. Instead, you just turn it upside down, and the surface tension will hold it in place there. Aspirin. Aspirin is aspirin. So aspirin, they're going to call for aspirin. This is what they want, the baby aspirin, because it's chewable, because we can't have people drinking water in the back of the ambulance. If someone wants albuterol, these are called albuterol bullets. When you open this package up, in here, this is albuterol. So albuterol sulfate, this is 2.4 milligrams, and the way that this works is you take the top here and you twist it off. Okay, once you twist it off, then the medication can be squirted into a nebulizer, and that can be given then to the patient. So albuterol bullets, this is what they're looking for. Another one that we see at sometimes is solumedrol. This is methylprednisolone, but no one's going to send you to the truck to get methylprednisolone. Instead, they're going to send you to the truck to get solumedrol. In this particular instance, this has a rubber stopper right here. It has sterile water on the top and a dry medication at the bottom. So the way this works is you're going to press down on this orange thing, and the ball is going to drop inside the dry area, and it's going to allow the water in there too. So I'm going to try this. Here we go. The medication is now, the water is in there, so I'm going to shake it up. Once it's shaken up, the top, you can pop the top off, use a needle to draw it out, and then administer it. So Solumedrol is one of the few drugs that comes in this kind of packaging, so it's pretty easy to find. And what Solumedrol is it's a steroid. We give it to patients who are having severe respiratory distress, and like many steroids, it helps with lung tissue. Some of the other medications that are non-narcotic medications that we use, I'd like to go over with you. This one you may find in your ambulance, tetracaine. Tetracaine is actually a medication used to anesthetize the eyes. So people with eye injuries, the tetracaine can give pain relief if they've got some sort of an issue with something stuck in their eye or some other abrasion of the eye or something like that. So it's used to help reduce pain. But they'll call that tetracaine. Some of the prepackaged syringes that we'll use, this is one that we should be familiar with already, Narcan. Also, but no one's going to send you to the truck and tell you, go get the naloxone. They're going to say to you, go get the Narcan. This is what they're looking for. They may send you to get the epi, cardiac epi. We already had a look at anaphylaxis epi. Oops. Anaphylaxis epi, which is 1 to 1,000. This is cardiac epi. You'll notice that the concentration is 1 to 10,000. So it's much more dilute, and this is what we would use for someone who is having a cardiac issue. Obviously, using this one here would be inappropriate. If you give a patient with anaphylaxis this, it's not going to do that much to help them. If you give a patient with a heart condition this one here, you could cause some pretty serious damage. So you don't want to mix those two up. Cardiac epi, anaphylaxis epi. Glucose, D50, this is D50. Dextrose, 50%. This is going to be a pre-filled syringe also, and this is given for diabetic patients to try and quickly raise their blood sugar. It comes in this kind of a package. It's usually pretty big. There are combinations D50, 50% dextrose. There's also D25, which is 25% dextrose, and probably more popular now amongst all EMTs is this one here. Comes in a bag. This is 10%, what we call D10, 10%, which is really a much more humane way to give people sugar. It doesn't cause anywhere near the spike in their blood sugar, allows them to have a smooth, steady recovery from hypoglycemia. Usually it's packaged, however, in a bag like this with fluid. It's 10% dextrose, so D10. Lidocaine. This is lidocaine. Lidocaine is in the same family of drugs as Novocaine, and lidocaine is used for the cardiac to try and calm the heart down when the heart has arrhythmias. It's one of the arrhythmias that you could use to calm a heart down. They're going to call it lidocaine. There won't be any fancy names for it. Bicarb, sodium bicarbonate. Sodium bicarbonate is used to acid-base balance, to balance the acid-base in the human body. When patients go without exhaling carbon dioxide enough, then the carbon dioxide builds up and starts to form acid inside the body. The patient becomes what we call acidotic. That's when we use this medication, especially in cardiac arrest patients who have been down for a while. They tend to become very acidotic, and it's part of the protocol to give them sodium bicarbonate to help balance out the acid base. They'll call it sodium bicarb or just bicarb. Now, if you're able to change the patient's heart with lidocaine, so you give them this lidocaine and that's going to help the patient's heart, then once you achieve your goal, you need to have a maintenance infusion to keep that going, and that's what this is. Then you'll find this lidocaine here. It has got 2 grams that's been dissolved in this fluid, and the EMT, the paramedic's going to start an IV and deliver this at a certain dosage and rate to keep the heart calm and keep the heart from having arrhythmias. Let's take a look at this one here. Dopamine. Dopamine is something that we use on patients if they're having a blood pressure that's very low and they need to improve contractility of the heart and get the blood pressure to go up. Then this is one of the medications. We don't give it very often, but dopamine comes in a pre-filled bag like this. It's given in an IV, and it has to be very carefully measured out. Let's take a look at one more here that I want to show you. Glucagon. Glucagon is glucagon, and that is a medication that we give to patients who have low blood sugar. If for some reason we can't start an IV line on a patient, we're having trouble getting, the patient can't take oral glucose, then this would be the medic's next choice. This is given intramuscularly as a shot, and what it will do is it will cause the liver to start releasing glucose. So it's not a really quick, big fix, but it will give you some time to try and get the line started and some other way to get sugar into that patient. So we use glucagon, by the way. This is the most expensive drug that we have. You would think maybe the pain relievers and narcotics would be more expensive, but they aren't. This one is the most expensive, but it's kind of a pain to put together. The first thing that we have to do is find ourselves a source of water that's sterile. In this case, I have a 10 milliliter syringe here that I'm going to use. Basically, I'm going to get rid of 8 or 9 milliliters of water. That'll do. And then what I need to do is mix this up. So I take my drug there and I use this device to inject. I'm going to use a needle. This is an IM needle here. Pop the top off, wipe and sterilize the top. I'm going to first pull all the air out of here. Then I'm going to inject the fluid in. Shake it up. You can actually leave the syringe in to shake it up. Mix it, and then I'm going to draw the fluid back out again. Once I've got drawn all the fluid out, now I can take this, shake it up, take this, and I can give the patient an intramuscular shot and inject the glucagon. That's going to help bring the patient's blood sugar up, at least give some improvement on it. It's kind of an involved process, though. Okay, let's take a look at some of the other drugs that we will run into, especially pain relievers and narcotics. I kind of like this video because I can actually show you them. I can't show you them when we're together at school because they're controlled substances. Can't bring them into the school. Here on the fire department at the fire station, I can show them to you. Here's one of the ones we start to use right away. Ketorolac-tromethamine. Well, no one's going to send you to the ambulance to get ketorolac-tromethamine. Instead, they're going to send you to get Toradol. This is Toradol. Toradol is an NSAID, a non-steroidal anti-inflammatory drug, a lot like aspirin and ibuprofen. It's from that same family of drugs. A very, very effective pain reliever, especially useful for kidney stones, gallstones, abdominal pain like that. This will give the patient more pain relief than a narcotic. Another controlled substance here, Valium, otherwise known as diazepam. No one's going to send you to the ambulance to get diazepam. They're going to say get Valium. This is a particular kind of injection called a carp inject, but this is what it would look like, or it might be in a vial as well. It's a benzodiazepine, and benzodiazepines we use basically to break seizures and to try and anesthetize patients. Here's another one that we use. This says midazolam on it, but no one's going to send you to the ambulance to get midazolam. Instead, they're going to send you to get Versed. Versed is also a controlled substance. It's used for anesthetizing and some pain relief too. If you have a patient who's having a seizure, you have a patient who's extremely combative, you can use those benzodiazepines to help settle that down. The other one I have here to show you, it's skittled away. What's this one right here? Fentanyl citrate. So this is fentanyl. Morphine, I didn't have a spare bottle out that I didn't want to break open a new pack for that. It comes in a vial too. It looks, these vials for morphine actually look a lot like the same as the ones for Versed. This is how we usually find fentanyl packaged. It's also in a glass vial. You break it the same way that we broke the vial to give the epinephrine, pull it out the same way, and then give that to the patient as well. These are all controlled substances though, and you're not likely to be giving these. You may be helping a medic give pain relief. You should at least know where they are and where they're kept, because they're usually kept in a locked, narcotics are usually kept separate from other drugs that we looked at today, and those drugs are kept in a separate locked place, and you should know as a crew member where those are and how to get them in case they're needed. There are more. This is some of the main ones that I had a chance to go over with you today, kind of a supplement to what you're learning about medications. I hope you find this helpful. I'm looking forward to seeing you guys in person again. For now, we're just going to do some videoing and see how that goes. You guys have a good day, and I will be seeing you soon.